Here's a patient, 68-year-old male with swelling of the right calf going on for several months, like 4 months or so.
More. 6.
6 months. For 6 months, there was no injury. He did actually suffer a fracture in the right distal fibula about 6 weeks ago. He's had all kind of ultrasounds. One ultrasound did show a clot in the posterior tibial vein, but then he had repeat studies done which showed no blood clot. One ultrasound suggested a mass in the lateral aspect of the right calf, and then he had an MRI which didn't show that. So we got all these kind of mixed studies out. Certainly you can appreciate a lot of swelling in the calf. So I'm just curious what the muscles look like here on ultrasound. His left side looking at the lateral gastroc, and we're going over to the medial gastroc. You can see the soleus underneath that. Here we're looking at normal lateral medial gastrocnemius muscles. You could make out an interface between those two muscles. And you can see the darker soleus muscle underneath, and you can appreciate that thick fascial layer between the gastrocnemius muscles and the soleus muscle. Going deep, you can see the fibula, flexor hallucis longus, which is the most lateral muscle of the deep compartment of the leg. Here we are now looking in a sagittal view again on the normal side. We can see the feathery texture of the muscles. Here it appears that the feathery ecotexture of the soleus and the gastrocnemius muscles, they're almost forming maybe like 70-degree angles to each other, almost like the end of an arrow. Here we are on the affected side. We can appreciate somewhat irregular hyperechoic muscle that's smaller and atrophic. Here's the medial gastrocnemius muscle. You can also appreciate some fluid underneath the muscle, as well as fluid tracking within the subcutaneous fat. You can see this in a cellulitis or a deep infection such as necrotizing fasciitis as well. Here again, looking at the lateral gastrocnemius muscle in short axis or an axial plane, and we can see hyperechoic atrophic muscle with fluid underneath the muscle and also fluid within the subcu fascial layer as well. Here we are looking at both medial and lateral gastrocnemius muscles, and again you could make out a separation or a fascial plane between those two muscles, and also you can appreciate a thick fascial plane overlying the soleus muscle as well. Here we're looking at some subcutaneous fluid. Here we're going to the lateral gastrocnemius muscle in sagittal view, and again you can appreciate a hyperechoic muscle consistent with atrophy, still maintaining that feathery ecotexture, but it's somewhat distorted as compared to the normal side. Here we're seeing a intramuscular vein within the medial gastrocnemius muscle, and again appreciating a hyperechoic medial gastrocnemius muscle overlying the soleus muscle. Now we're checking for a Baker's cyst. On the right side, you can appreciate the boomerang shape of the medial gastrocnemius tendon, and we also can appreciate anisotropy of the ovoid, pretty large tendon of the semimembranosus. Here again, we can appreciate the semimembranosus tendon. Now it's hyperechoic, and there's anisotropy of the medial gastroc tendon. Now we're just toggling the probe, and you can see those two tendons going in and out of view.